Hi, and thanks for joining the latest in our series of How We Work podcasts, where we review some of the projects the team at Shaw Consulting have been working on. As usual, I'm joined today by Managing Director Chris Shaw. Hi Chris, good to catch up again.
Hi Steve.
So let's start then. If you could explain who Mersey Care are and what it was that you were appointed to do for them.
Mersey Care, they're an NHS Foundation Trust. They employ over 12,000 people across Merseyside and Cheshire, serving about 15 million people. And they're one of only 3 trusts across the country that provide secure services. So that's where they're providing services for some really vulnerable and troubled people in these secure units. Now, our work was looking at the workforce management systems. We were asked to take a view on the systems that they had in place to manage their workforce and look at a better way of working. We looked at all the different interactions they had, both manual, system-led, and we were trying to identify where there could be some operational efficiencies made and where we could deliver the extra capacity for their organization to be able to really reduce their levels of absence. A lot of this absence is driven through the challenges that the organization have in delivering the care and support services to their staff who might be struggling with an injury or an illness, and just making sure that they've got the systems in place to be able to give them those interventions, and the management team have got better visibility or a good visibility and handle on their staff.
It sounds like another complex organisation and complex project to work on. What exactly did the project involve for you and the team?
So we had a number of meetings and workshops with different people from across the trust. We were coming in to, again, like I say, do that mapping of systems and processes, and then look at the options around the systems that they could potentially acquire. They'd already done some work in identifying a system called Impactors, and that system provided a number of features and capabilities which could and would improve absence levels and give Mersey Care a better handle on absence and the interventions that they needed to deliver to the staff. So we were looking at the existing workforce system plans, the sequencing, the intended outcomes around trying to deliver that health and well-being interventions for staff when they were sick, making sure that the systems delivered the right level of reporting to ensure that they could reduce sickness and the level of absence episodes, because all that leads to a loss of clinical capacity across the trust, which means then that they don't have that capacity to deliver the services that they need to do for their customers, you and I. We were looking at what the business case was for bringing in this new system. We were looking at what the cost was for the organization, both financially and also from a capacity, lost capacity. And then we were looking at, well, if we were able to join the dots better, have the system support the process, automatically remind managers to do the checkups with their staff who are off, better visibility of all that management information, what would that mean to the business in enabling them to reduce absence levels and give the help and support and the interventions to the staff to get them back in and working more effectively.
And through the work that yourself and your team did with Mersey Care, what were you able to achieve for them?
So we went through the development of the processes. We looked at the new operating model. We looked at the business case that backed up that new operating model, which was that investment in the Impactors solution. And we looked at how that solution would need to interact with the different systems that they were using across the business. I mean, some of the key ones within the NHS is there's a system called the ESR. It's a national system. It stands for the Employee Staff Record. There needed to be interaction with that system because it's the system that all the payroll happens. So making sure that that worked effectively was key. There was also a rostering system that this system would need to inform. So if people were off sick and then they couldn't be rostered onto their shift patterns or onto their clinical duties, then it needed to be informed by the impactor solution that that was the case. So, we were looking at those interactions as well. So from that, we were able to, develop the business case. We worked with the finance team at NHS Merseyside to ratify the business case, the findings, the estimated savings, the benefits realisation model. We might have identified a non-cashable benefit or a cashable benefit. What's a realistic profile of realising that benefit? And that's really, we might realise 20% in year one or 40% in year two, etc. So we spent quite a lot of time ratifying the business case. And then we worked with the senior team to present that and get that signed off. As a follow-on to this project now, we're working in a program management capacity, helping Mersey Care implement this system in as far as, making sure, one, the supplier Impactus delivers the solution as per what they said it would do, but equally making sure that the organisation goes through the business change that they need to do to make best use of this system.
And finally then, Chris, what was the project's final outcome?
The key one was, probably touched on it earlier, but the solution was approved, it was signed off. They are now in the process of implementing this system. It's not an easy path, implementing a solution of this size. You're talking a lot of change. The solution never fits like a glove. So, there's quite a bit of customization of the solution and configuration of the solution that's needed to make it fit with the organization's current practices and the new working practices and processes to ensure it's a success. But we're working through that with Mersey Care, and it will deliver the change that they need.
Chris, thanks again for your time. Always really good to hear how you and the team are supporting clients. So please subscribe to our social channels for more podcasts. And thanks everyone again for taking the time to listen today.